Here we'll talk about hyoid bone fractures. It is seen most commonly in the people above 40 years of age. It is of three types. The first is inward compression fractures. The second is anterior-posterior compression fractures. Third one is avulsions or the tractions, which is also known as tuck fractures. Coming to the first one, it is seen in case of throttling, and the greater cornea of the hyoid bone is getting fractured here. The two things you have to remember here is the tear of periosteum is towards the outer side, and the posterior fragment displacement is towards the inner side. So how I remember it is, in the inward compression fracture, the fraction is happening inward, right? Then the tear of the periosteum will be the outward. When the fracture is happening on the inside, the tear will be on the outside. This is how I remembered it. So inward compression fractures, the tear of the periosteum will be on the outer side, and the posterior fragment will be displacing towards the inner side. Now coming to the anterior-posterior compression fractures, it is seen in hanging, and there will be AP compression, anterior-posterior compression, and also the tear of periosteum will be on the inner side here, the opposite of the first one, and the posterior fragment will be displacing outer side. So if you remember the first one, which is inward compression fractures, you can write the opposite of it in the anterior-posterior compression fractures. Now coming to the third one, which is avulsions or the tractions or the tuck fractures. It is seen in chronic alcoholics. Here you can see this hyperextension of the neck muscles leading to the muscular overactivity, and there will be the traction of the thyrohyoid ligament. So the avulsion, the L in the avulsions reminds me of thyrohyoid ligament. Here the hyoid bone is drawn upwards and held rigid. When the muscles of the neck are super extended, the hyoid gets higher and will be in rigid position. So have a mnemonic to remember this. IT life is full of fun, they drink alcohol. IT reminds me of inward compression fractures is seen in throttling. Fun reminds me of haha, right? HA, anterior-posterior compression fractures is seen in hanging. And the third, alcohol, reminds me of avulsions because it is seen in chronic alcoholics. So this is about hyoid bone fractures. To summarize, it is of three types: inward compression, anterior-posterior compression, avulsion. Inward, IT is seen in throttling. IT life is full of fun. The fun is, remember the word haha for the fun. So H stands for hanging, A stands for anterior-posterior compression, is full of alcoholics. Avulsions or the tractions can be seen when they are lying over the chair. You can see the hyperextension of the neck, so which can lead to the fracture in the hyoid bone. And the two things you have to write in the first 2 points is tear of periosteum and the posterior fragment displacement. So in the inner compression fractures, the fracture is occurring on the inside, so there will be tear of the periosteum on the outer side, and the posterior fragment displacement is on the inner side. The opposite is for the anterior-posterior compression. The tear is on the inner side, posterior fragment displacement is on the outer side. Coming to avulsions, it is because of the super or the hyperextension of the neck muscles seen in chronic alcoholics. So this is about hyoid bone fractures. Bye.